Hey guys, Dr. Celestine here, and I want to talk to you about a fairly new test to help predict preeclampsia. Now, preeclampsia can be a severe and very deadly disease. It only occurs in about 1 in every 25 pregnancies, and African American women are 3 times more likely to get preeclampsia according to the CDC. So listen up, because this is going to be really important. Now, LabCorp, which is a company, has created 2 tests now in order to predict preeclampsia early. Their first test was done later on in the pregnancy, looking at 2 different markers, and their newer test is done earlier on in the pregnancy in the first trimester, looking at 4 different markers. So this newer test can be done between 11 to 14 weeks, and it detects the risk of you developing preeclampsia at less than 34 weeks. Now, preeclampsia is a high blood pressure condition that also involves protein in the urine and can have a whole host of negative complications in a pregnancy. We, as obstetricians, have come up with some risk factors for preeclampsia. So even if it's your first pregnancy, there's a few things that kind of go together that make us think that, you might be at a higher risk than the average person. And in that case, we would start you on potentially aspirin between 12 to 16 weeks of your pregnancy, do closer monitoring, things like that. But now we have this blood test that can potentially test for the risk of preeclampsia with a 90% accuracy. Now, what does that mean? Honestly, as an obstetrician, I'm not too sure yet, because I think maybe it would be more utilized in somebody that it's their very first pregnancy and we're not really sure if they have risk factors. And yes, would be probably better to use if it was a little cheaper, which right now it's clocking in at around like almost $300 to do this test. So that maybe is where it would be more utilized. But somebody that has had a history of preeclampsia, they've had more than one pregnancy, maybe not so much, because we already have like our little markers up that, this person could be at high risk. So maybe if you're like a brand new mom, potentially as an obstetrician, I think this could be beneficial, but it's got to be a little bit cheaper and maybe even covered by insurance plans in order to be utilized more and to be utilized across the spectrum of all patients, all socioeconomic classes and things like that. So although I think these tests are great and I love that we're moving forward in this direction, especially since there's a small group of the population that's really at high risk for this condition, I think we have a little bit more work to do in terms of coverage for the test. So there are some new tests, some new blood work tests to establish a risk of preeclampsia. They do exist. I want you guys to know about that. The utility of it, long-term and in the mass amounts of people, we'll see. But it's a step in the right direction. And if you want to learn more about preeclampsia, check out my podcast episode at forvaginasonly.com and anywhere that podcasts are streaming. I'll see you guys next time. Bye.